Thank you, Connie, and Happy New Year to everyone. It is a pleasure to see you on screen or hear your beautiful voices. I've actually spoken to some of you. I want to, before I get into business, right, can we just take a very quick moment? In treatment, we often talk about engagement and really setting the tone. Can we just take pause as administrators and think about all that we do for a moment and pat ourselves on the back? I want to just really acknowledge each and every one of you. No, seriously, pat yourselves on the back. I just want to say you, literally, right? This is the beauty of Zoom, right? You really are true heroes in my eyes. I think, as I go into the guidance center work, we can't do it without you. There's, it's partners in planning. It takes a village to raise a child, like literally in Long Island, villages to raise a child. And I'm really happy to be here and be able to talk a little bit about what we do at the Guidance Center and, more importantly, what are some of the trends that we're seeing. But what actually, before we get into that, I just wanted to give you a sense of who I am, because I am new to the group and I actually am new to the Guidance Center. I have been at the Guidance Center for 7 months. I am a licensed clinical social worker by profession, a graduate of Hunter College School of Social Work. I've actually been in the nonprofit social sector for this year would be my 27th year. The last 16 of those years have been focused primarily on children and families. My previous work has been with adults with co-occurring needs, adults and families with HIV, and the elderly population. My work with youth has been a wide array. I've worked with youth who are predominantly experienced out of community placement, so disruptions, those who have been involved in multiple systems, whether it be foster care, juvenile detention centers, residential care. My experience with residential care has been with specialized populations, those who have mental health challenges, developmental disabilities, and those who have been commercially sexually exploited youth. I've worked with basically a lot of children and families with a significant level of trauma, who often, surprise, surprise, engage in high-risk behaviors, very often substance use being the primary area of concern. I heard earlier from Jen, when folks' needs are not getting met or the parents' needs are not getting met, then nobody else's needs are getting met. And I worked on a campaign, Healthy Minds, Healthy Kids, knowing that if you don't have that early intervention, the long-term impact could be quite devastating. I'm really excited to be part of an organization that is really doing incredible community work and meeting the needs of children and families, because we know this pandemic has shown that things are changing and they're changing fast each and every day. I think I even walked into the conversation about the online gambling when I first walked in, which is very, we needed more on our plate at this time, right, to sort of, tackle. So that's sort of me in a nutshell. And again, thank you, Connie, for having us here. So who are we, right? North Shore Child and Family Guidance Center. Some of you who are familiar with us often refer to us as the Guidance Center. We've been around for 70 years. Next year will be our 70th year. We serve all of Nassau County. We're the lead provider in children's mental health services, but we really honestly do so much more than that. Our mission is to restore and strengthen the emotional well-being of children and families, 0 to 24. Now, I know 24 sounds like adults, but very often the young people that we serve in that cohort are living a pediatric lifestyle. We have 3 offices, Manhasset, Westbury, and Roslyn. This is what I want all of you to really understand, and this is what I think really makes us unique. We turn no one away for their inability to pay. We are committed to equity and access for all and equanimity. Lauren, who is our Director of Development, works tirelessly raising funds with the community to ensure that any family that has any kind of financial hardship gets the right services that they need. So really there is no wrong door when you come to the Guidance Center. I just want to preface a little bit and highlight that what we do at the Guidance Center is that we treat the family ecosystem, so literally in utero to older adults. When I review the programs, you'll see how this comment is further captured. But we have a wide array of services. So what is it that we do? Some of our services include outpatient mental health, We do it all: individual, group, family, in-person, virtual, a little bit of both. The bottom line is the child and the family are always in the driver's seat dictating their care. We do community-based mental health. So for families who have not really done well traditionally, where we expect them to come to us for services, we bring the services to them. We have a family advocates program where we have a parent-to-parent model, if you will. So these are parents that I describe as credible messengers that have their own lived experience with being system involved for themselves or for their children, who then become peer supports for those who may be experiencing some level of crisis. We also have wraparound models of care where we bring the clinical work, the therapy to the home, the medication management with our psychiatrists to the home. And we coordinate with multiple systems to help the family and ensure that they don't fall through the cracks. We have a drug and alcohol treatment program. So for our youth, young adults and youth who have co-occurring chemical dependency and mental health struggles, we address that. We have also a drug and alcohol treatment prevention services that we offer to local school districts. Some of our specialty programs involved are early childhood. We have a maternal depression, postpartum depression, and other that treats also other perinatal mood disorders. We have a Good Beginnings for Babies for parenting teens, so very young teenagers who are pregnant and about to be first-time moms. We offer a lot of support. We have a Latina Girls program where we offer bilingual and bicultural individual and family mental health counseling. We also offer them respite services, as well as respite services for all of our other programs, because this is not going to be a shocking statement. Parents need a break from their kids and kids need a break from their parents. And sometimes not having sort of that time to hit the reset button really can result in a hospitalization, substance use, a variety of behaviors that can be really challenging and fracture a family. So we have respite programs that really promote social and youth empowerment. We have an incredible triage and emergency program where we work with hospitals, with children and young people who are ready to come back to the community, but really need a high level touch to give them that support during that transition. We also have a suicide prevention program and a grandparents program. It is not surprising that we have found that many grandparents have unfortunately become the primary caregivers for their grandchildren because they have lost their own children as a result to COVID or to substance use. So that is it in a nutshell. Lauren, I'm going to see, can you keep me honest? Did I miss a program? I always miss a program. Wilderness. We have a wilderness respite program. It's the only one in the county where it is a respite program that is, just as it sounds, wilderness. It is outdoors. There are rigorous hikes that we take throughout New York State that give young people the opportunity to team build, work through conflict, overcome adversity, and build their resilience. So
BOCES.
And right, there's school-based mental health. No, it's okay. School-based mental health. We have some school-based mental health programs as well. Middle school, elementary, and high school. So that is us in a nutshell. There's a test on this, so I hope you took good notes. No, I tease. I will make sure that any information that you want, I will share with Connie to disperse with to the group. I just want to take a couple of minutes to sort of, echo what we're seeing in our own work as it relates to addiction and to mental health needs. There are more and more emergency triage cases that we are seeing as the result of the pandemic. I know all of you know that the pandemic did not cause this. It certainly enhanced it and helped to naturalize mental health and addiction, right? It's not an exception. It's something that we find very often when there is a significant amount of trauma, lack of resources, and quite honestly, community stress, right? And I think we've all experienced that. Here at the Guidance Center, we, through our triage and emergency program, we respond very quickly. Any cases that come to us are seen within 24 to 48 hours of getting the referral. We've been seeing higher and higher rates of suicide attempts, suicide ideation, self-injurious behaviors, more so than we've seen in the past. Some eating disorders as well. Clearly a lot of issues with sleep patterns, substance use, a higher range of substance use, online gambling for sure as well. So I think what I'm saying is not a shock as I look at everyone's faces to what you're hearing and seeing in the community. I think what's most important is that, you know, as a community provider, we're seeing it too. And we are advocating with a lot of our coalitions and alliances to ensure that the message gets the word out, and that we are naturalizing this and not stigmatizing it, and making sure that, you know, we're out there. So if you think a family needs a service, or you're not sure, if a family has a question, connect yourself with us. There's no wrong door. If we can't help and there's a gap in our service, we will connect you with our collaborative partnerships that we have. And so, and I hope that that bi-directional situation occurs as a result of not only this meeting, but I think in general. So I've said a lot. I said it fast. Native New Yorker here. I think you could all tell that. I'm happy to answer any questions that you may have.
I just wanted to share, I work at LICAT. I've worked there for 4 years. North Shore Child and Family's always done a wonderful job, I think. And every time we've worked to connect to family, there's always been a spot for that family. And one of the things that's always challenging, I think, for adolescents is, one, finding care, period, but two, finding care that's not just, yeah, we have an adolescent program, sure, we'll just provide them with whatever care, but that really provides care that's conscientious, and that, I mean, the number of programs you listed is dizzying in some ways, right? So it's important, I think, for people just to know that there is that level of, I'll use the same word again, just conscientious care for teens and their families, that everyone kind of can get involved, because without that, the care isn't as good. And you guys have done that for a long time. So I'm just kind of seconding that good work that you guys are doing, and that 24 to 48 hours is not a joke. People really do get contacted and get connected very quickly. They do really good work. You guys do really good work.
Thank you, Adam. I did not ask Adam to say that, so I just want to make that clear.
No, you didn't. I've just connected a bunch of people, especially in the past couple months. You do a wonderful job.
I appreciate it. You know, and I just want to share, as the new executive director, you know, my vision for this organization is just to, you know, while dizzying in our wide array of services that you can pick a la carte, or, you know, braid them together, my vision is to grow and to continue to look at our gaps in service and see how we can have it in-house or partner with the right folks in the community, because we all know this. The last thing you want is someone in crisis to come at your doorstep and say, you have to go here and you've got to talk to them there and call this person, and oh wow, there's a waiting list. That is not what we're in the business of. And we know that critical point of early access and early intervention can make and break and really honestly save a life. So that is my vision. I've only been here 7 months, so give me some time. Don't put pressure on me like that. But we will get there. And I hope to partner with some of you to successfully achieve that.
Yes, it is. I can't turn it off. And thank you, Kathy and Lauren. I had the opportunity to meet with them right before the holidays and was really impressed with the depth of their work, and felt that it was important that we did a reintroduction, even though many of us may have worked with them in the past. So thank you for joining us, and thank you for being a resource